many times is challenging is figuring out exactly if it is PTSD or is it something else. Kind of going back to the example of an individual going to the doctor, and they said, oh, I have a sore throat, I have a runny nose, and the doctor says, okay, you have a cold. Well, later on, they might say, well, doctor, I also have itchy eyes. So based on the addition of that symptom, the diagnosis changed. So now he might say, oh, actually, it's not a cold. You actually have allergies. And the same thing with mental health. Sometimes as time goes on, a symptom might change, or it might intensify, it might reduce, or it might transform to something completely different. What happens many times is a lot of children who are diagnosed with ADHD many times might actually have PTSD. In 2011, I was doing some research, and I noticed in 2011 about 6.4 million children were diagnosed with ADHD who were between the ages of 4 to 17. And many of the qualifications for ADHD are very similar to PTSD. For example, difficulty concentrating, they're easily distracted, difficulty sitting still, many times they'll leave up their seat very often, and many of those symptoms are very similar to PTSD. And one of the trainings that I have coming up, that's something that we'll be discussing, is trying to figure out what is the difference between ADHD and PTSD. And one of the leading symptoms would be a traumatic event.